Okay, peeps, let's do some more arterial blood gas analysis. We did a couple of problems before, let's do some more today. And today we'll look at the fully compensated case for the first time, okay? So just remember, we're always going to be dealing with three quantities here. The overall pH, the partial pressure of carbon dioxide, and the concentration of the bicarbonate ion. Now I didn't write up last time when I did the example, I probably should have. I mean, I said it verbally, but partial pressure of CO2 is telling you about the respiratory component. Bicarbonate is telling you about the metabolic component, all right? And that's how we're going to decide what the cause is of the pH imbalance, okay? These problems are really easy to do. You just got to follow the steps and you'll be safe at home, okay? Just like what you're supposed to be in baseball, okay? In football, you wear a helmet. In baseball, you wear a cap. Football is played on a gridiron. Baseball is played in a park. In football, you got a penalty. In baseball, you make an error. Oh, I made an error. In football, you have sudden death. In baseball, you get extra innings. Extra! In football, the object of the game is to march down the field, invade enemy territory using a combination of a ground attack and aerial assault until finally you penetrate the end zone and spike the ball. In baseball, the object of the game is to be safe at home. George Carlin, brilliant. If anything ever captured the difference between baseball and football, that's it. So let's do our first problem here. Remember, we always do pH first. You can do these in any order. I just wrote them in this one. You just have to do both of them, that's all. So pH of 7.52. So where are we? This person is in a state of alkalosis, all right? Now, you should know, if I were to ask you, and I'll do, on the exam I'll give you problems like this, but I will ask subsequent questions. I would say, tell me the signs and symptoms of this person. All right, remember alkalosis? I showed you the two in the PowerPoint. The orangutan, which is, oh, what to do, and, the boy who killed with a rake, all right? This is the boy who killed with a rake, all right? Tetany, hyper, reflexive. This person's bouncing off the walls, okay? So, what do we do next? Partial pressure of CO2 is 31, all right? Well, 35 to 45 is normal, so where are they? They are alkalotic, okay? And then let's look down here. Bicarbonate is 24, normal 22 to 26. Oh, let's see. They're normal, aren't they? So remember, what do we do next? So we see this person is in a state of alkalosis. I'm guaranteeing you that when you look at these two, one of them will match that, one and only one. The other one will either be normal or it'll be in the opposite direction. If it's normal, it's uncompensated. If it's in the opposite direction, then it's then it's compensated, is all we have to say, partially compensated. So what do we have here then? This matches. This person is in a state of respiratory alkalosis. Okay, and is the urinary system currently compensating for it? No, it's not. It might be trying to, it might just not be there yet. Remember, the urinary system is slower. It's more powerful, but it's slower. So we say respiratory alkalosis uncompensated, all right? Do you see how easy this is? This is seriously easy. There's nothing to it, okay? Now, I might also ask you in the subsequent questions on these problems, what might have caused this? Give me a couple possible causes. What caused this person to go into respiratory alkalosis? You should be able to think that through. Panic attack? Pain? People in pain, oftentimes respiratory alkalosis. So something like that. Give me a couple of possibilities for why they're that way, all right? So there you go. Look how easy these problems are to do. It's just that simple, all right? So let's do another one. It's a pain to have to try to erase these things so I can do them again. It's going to be imperfect, just like me, okay? Don't be upset. Well, why would you be upset? Why would you care anything about me? No one else does. Why would you? Okay, so enough. All right, so let's do another example here. Instead of these numbers, let's look at different numbers. Let's try, okay, let's try stay. Let's try crap, where was I? Okay, let's try pH of 7.39. Partial pressure of CO2 is 31 millimeters of mercury. Don't forget the units. Bicarb, 19 milliequivalents per liter. Okay, let's take a look. What do? Always check pH first. 7.39. Oh, wait a minute. That's normal. This person's normal. We're done, right? No. Let's check the other two. You always have to check the other two. Partial pressure CO2 31. No, this person is below. This person is alkalotic. And bicarb 19, yeah, they're below on that as well. They are acidotic. Wait a minute, what the hell is going on here? What the hell is going on here? All right. Well, so what we do, and I gave you instructions on this sheet right here. So let's read them. This is what we call a fully compensated case. In other words, one of these is the problem. The other one is not just compensating, it's compensating so well it's brought you back to normal again. Okay? So, I tell you right here, in the fully compensated examples, the pH is normal as a result of the compensation, but the out-of-range values for CO2 and bicarb indicate an underlying issue. In this case, it is necessary to see whether the pH is on the acidotic or alkalotic side, and then see which of the other two matches. So, is the pH on the acidotic side or on the alkalotic side? Well, in other words, the middle between these two would be 7.4, right? 7.39 is just barely on one side, but it's still on one side, and that's just what we go with, okay? So it's on the acidotic side. So therefore, we say that this person is in a state of acidosis, all right? And because the other one is out of range, that means it's compensated, all right? Not just a little bit compensated, it's fully compensated because they're back to normal, all right? So once again then, what we're going to do here is we're going to say, yes, this person is in acidosis, and the cause, the one that matches that, is here. This person is in a state of metabolic acidosis, and the urinary system is doing the job. It's getting you back to normal. I mean, the respiratory, no, what did I just say? Yes, the respiratory system is getting this person back to normal again, all right? So, therefore, this is fully compensated, all right? Now, once again, in subsequent questions, I'll ask you to tell me things about this example. So, metabolic acidosis. What would be some possible causes of metabolic alkalosis? We know a particular type of patient that might be here because they're making too many ketone bodies, so a diabetic and diabetic ketoacidosis. What else? Metabolic acidosis. Maybe a little kid who swallowed a whole bottle of aspirin. Maybe a chronic alcoholic, because alcohol works like an acid in the body, okay? And then I might say, what would be the behavior of this person if you observe them? So they're in a state of acidosis. What's acidosis again? Remember the orangutan? Oh, what to do. This person has depressed reflexes. They're sluggish. They're unresponsive, okay? And then on top of that, what else do we know about them? Well, if the respiratory system is compensating, all right, it's compensating and they're in acidosis, how would the respiratory system compensate for acidosis? By trying to get acid out of the body. And how do you do that? By hyperventilating, all right? So this person would be hyperventilating. They should have a respiration rate above 20, all right? Remember 12 to 20 normal. So remember with diabetic ketoacidosis, that was called the Kussmaul breathing. These are the diabetic patients who are, probably on death's door, just frantically trying to get the CO2 out, okay? So that's all there is to it. We worked through 4 examples together, and we saw various possibilities. We saw partially compensated, uncompensated, and we saw fully compensated. So I gave you a whole sheet of practice problems, 20 practice problems. Just use these instructions, practice, get them through. And then if you practice them and you do these when the exam time comes, it'll be a piece of cake. or pie, depending on your dessert preference. Maybe a nice gelato, maybe an apple crisp, maybe a peach cobbler,